Endometriosis is a debilitating disease that affects women all over the world. This is a disease that requires very specialized input. Hello, I am Professor Dammika Silva, Professor in Obstetrics and Gynecology. Today we are going to talk about the services rendered from the Gynecological and Laparoscopic and Endometriosis Centre at King's Hospital, which we call the GLEC. This centre specializes in treating endometriosis, one of the most problematic diseases faced by women in the reproductive age in the world. So much so that all over the world there are centers specifically made to treat endometriosis only. And GLEC, or the Gynecological Laparoscopy and Endometriosis Centre at King's, is the first of that kind in a private hospital in Sri Lanka. If you look at endometriosis, it's a disease that we have been operating on for a long time, and our experiences are very vast in treating this disease. We are happy to say that we are able to treat endometriosis in par with every other international center in the world. Practically, we treat or do every surgical procedure done everywhere in the world at our center in King's. We have the state-of-the-art equipment and the expertise to treat this disease. Endometriosis, as you all may understand, is a debilitating disease that involves the pelvic organs of reproductive age women. And this is a huge problem because it involves the womb, the ovaries, the vagina, sometimes the bowel, sometimes the bladder, and the surfaces of the pelvis, so much so that it causes severe pain, and at the same time it can cause infertility or a combination of both. Endometriosis requires proper input by a multidisciplinary team. Of course, diagnosis is first. Diagnosis is initially by clinical assessment, and then it will be supplemented by expert radiological evaluation, which will require sometimes an MRI, but mostly an ultrasound scan. Once the extent of the disease is known, then of course treatment is initiated. Treatment may be medical by therapy depending on the patient, or sometimes we might need to go in for surgery. Surgery will require an input from many specialists sometimes, but usually it can be managed by a gynecologist. However, if bowel involvement is there, it might require colorectal surgeons. Sometimes if bladder or the ureters are involved, it might require urological surgeons. And of course, the pain needs to be managed by the anesthetist, and all this will come into play when we treat you at King's. At the same time, usually since endometriosis involves fertility problems as well, we have a specialist in infertility in our team as well. So as you see, we can provide the best of care in par with every center in the world for endometriosis, and we have a huge amount of experience amongst ourselves, the experts, to treat this debilitating disease. Thank you.